Hello, welcome to Life Matters. I'm your host, Brendan O'Connell. Well, we have a very special guest today who is the Executive Director of the American Association of Pro-Life Obstetricians and Gynecologists. She's board certified in that discipline in medicine. And we want to talk to her today about some very important cases, particularly one that's not talked much about but could have very wide ramifications for people who are in the healthcare profession. And the specific case we're talking about is Stormans versus Weissman. Well, welcome, Dr. Donna J. Harrison.
Thank you. Thank you for inviting me.
Dr. Harrison, could you tell us a little bit about this case, the genesis of it? Is it a medical thing, or what element of the healthcare industry is it involved with?
Well, this case involves a pharmacist who refused to prescribe, to dispense in his pharmacy drugs that are known to be able to kill embryos, because he, like many people, understand that human life begins at fertilization, and he did not want to be part of taking a human life. So the state of Washington decided to pull his pharmacy license because he refused to dispense this drug. And the case was appealed. He won the first appeal. The state of Washington won the second appeal. But the very concerning thing is that at the federal district court level, the court said that not only was a pharmacist required to prescribe drugs that can end human life, but that he could not refuse because of his conscientious objection. So that he could refuse to stock this drug and prescribe it if it was too expensive. He could refuse for a number of other reasons, but not refuse for conscience. So it was very clear that the intent of the court was to eliminate the ability of healthcare workers to conscientiously object to providing drugs that would kill embryos. So it is currently now before the Supreme Court, and it's a case my association, the American Association of Pro-Life Obstetricians and Gynecologists, filed an amicus brief with, because we stand in support of healthcare workers being able to conscientiously object to killing people, even little embryonic people. And so we are watching this case very, very closely, and we're hoping for a favorable outcome, that we will still be able to conscientiously object in the United States.
I see. And did you have other groups who also joined you in that amicus brief?
Oh, yes, the Christian Medical Dental Association, Catholic Medical Association, Pharmacists for Life. We had a number of different groups, and if anybody's interested in the actual brief, they can always email me, which is easy, donna@applog.org, and I'd be happy to send them the brief.
And the arguments, how does the other side try to argue? I mean, because biologically, I've heard arguments over the years of there's a difference between fertilization and implantation. Does the other side try to still argue that life begins at implantation?
Well, the other side doesn't do a lot of scientific arguing. It's a sheer brute force issue. It's that the state wants it done, and that healthcare workers are obligated to the state before they're obligated to the patient, and that the state wants it done, and so in order to maintain your license, the state has the power to tell you what to do. And in this country, that's never been the case. We've always recognized conscientious objection, especially when it comes to taking a human life. And so this particular case has huge ramifications for what healthcare workers can be forced to do by their states.
And well, what about could a doctor or a pharmacist refer them to another pharmacist or another doctor? What about the whole issue of referrals?
Well, in this case, the court, Washington, said that the pharmacist must dispense and was not allowed to refer for conscience reasons.
Wow, that's And so...
it's a scary case.
I know that over the years, the Hippocratic Oath has been watered down. Many doctors don't even... where I was always, when I started this show about 10 years ago, or 2003, I thought the Hippocratic Oath was fine and well, but I had Dr. Mildred Jefferson as a co-host, and she said, well, no, it's not. It's got several... there's several different pledges that you can take upon, graduating from medical school now, more so than the Hippocratic Oath. Does APLOG try to uphold the Hippocratic Oath, and yet other elements of the medical industry are trying to eviscerate it?
Well, Brendan, that's an outstanding question, because that's really at the core of our concern. You see, the Hippocratic Oath is what actually forms the doctor-patient relationship. It's the doctor saying, by all that I hold sacred, I will not kill you, and I won't kill your unborn child, and I won't kill your grandmother. That trust that a doctor and a patient have, that's formed by the Hippocratic Oath, because it's a specific vow that the doctor takes to always act on behalf of the patient, not on behalf of the medical profession, not on behalf of society. The doctor is acting on behalf of that patient. And so when the Hippocratic Oath has been gutted, and that's been since the 1980s, what you have is doctors who now don't necessarily have as their loyalty that direct vow to the patient. And see, if your doctor hasn't vowed not to kill you, if your doctor hasn't vowed that they will act always on your behalf, then you have a person with a huge amount of power, and their loyalties can be divided. They can be divided financially. They can be divided by a loyalty to something other than actually the patient. And so we do act, we do what we can to educate about what the Hippocratic Oath does and about how important it is that the doctor take the Hippocratic Oath.
And with Obamacare and the specter of rationing in the future, does that put more pressure on doctors who, say, really truly believe in the Hippocratic Oath? Is that another way to, I guess, whittle away people, doctors that take the Hippocratic Oath?
Well, it could be. It could easily be used for that. And our concern is that in all kinds of societies, in all kinds of places where physicians were forbidden from taking the oath, and I'll name a few that are quite chilling: Soviet Russia, Nazi Germany. The doctors were made into agents of the state. And so instead of acting on the patient's behalf, the doctors were pressured to act on the state's behalf. And that's where you get into these issues of quality of life and issues of who are we going to pay for, and who are we going to help, and who are we not going to treat, and euthanasia. And so when you have a doctor who's not always acting on the patient's behalf, who has a secondary loyalty, then you get the danger of the doctor, doing things to the patient, taking the patient's life. And we will not do that. There are doctors still who hold the Hippocratic Oath sacred, and we say, no matter what, we're going to act on this patient's best interest, and you cannot force us to take a patient's life.
Mm-hmm. Now, your organization, APLOG, how big is your organization? And as far as OBGYNs, how many OBGYNs do abortions versus, like on a percentage basis, versus that don't do abortions? Would you know that?
Yes, actually there's been a couple studies. But to answer your first question, our organization is 3,500, mostly OBGYNs, but we have some physicians of other specialties. We have also midwives and nurses, but we're predominantly OBGYNs. Mm-hmm. And as far as OBGYNs and abortion, it's very interesting. There's been 2 studies done within the last 10 years that asked doctors who were in practice whether or not they did abortions as part of their practice, which is a very different question than asking the doctor, are you pro-choice or pro-life? It's asking the doctor to vote with their scalpel. What do they actually do? And in those surveys, 85% of OBGYNs do not do abortions. And that's not because they don't know how. It's not because we can't empty a uterus, because OBGYNs are trained to empty a uterus at any gestational age. It's because OBGYNs recognize that they have two patients, both the unborn child and the mother. And most OBGYNs will not take the life of their unborn patient.
Mm-hmm. And can I ask you about, I guess, RU 486, and now the next generation is called Ella. Is it, there's often confusion, or at least for me, when they use the word emergency contraception. Is it really contraception, or is it an abortifacient that actually kills the baby in the womb?
Well, for Ella is a second generation RU46, and RU46 is the abortion drug that does kill babies in the womb. Ella is as powerful as RU46, so Ella can clearly kill babies after they've already implanted. Typically, the definition of a contraceptive is one that prevents conception. But the deceptive thing is that in the late 1960s, the definition of conception was changed. Around the world for hundreds of years, people have known that conception means when the sperm meets the egg. That is fertilization. But in the 1960s, the definition of conception was changed to when the embryo plants itself in the wall of the uterus. And by changing that definition, it allowed for drugs that can kill an embryo after fertilization, but before they have implanted in the lining of the uterus. And so actually Ella is a contraceptive in that it can kill an embryo after fertilization and before it implants, but Ella is also clearly an abortifacient because it can also clearly kill an embryo after the embryo has already implanted. So Ella both kills an embryo before implantation and kills an embryo after implantation.
Wow, that's really something. And I know I'm a little bit hopscotching around, but with this case of Stroman versus Wiseman, say the state wins, or with the U.S. Supreme Court, with only 8 people on the court right now, if they were to go tie 4-4, wouldn't that remand it back to, or then the state Supreme Court of the state of Washington, would that stand as the final issuance then? In other words, the state would have priority over the doctor-patient relationship?
Yes, and that is a huge concern, but it would still be a win for us in that it wouldn't be a national precedent. The worst case for us is if the Supreme Court decides 5-3 in favor of the state of Washington, because that would mean that the case is settled and that the national precedent is established. If the Supreme Court ties, then the decision goes back to the state win at the federal district level, but that means that it's not a national precedent and that we can bring the case again when we hopefully get a more favorable Supreme Court justice, one who's willing to look beyond politics and look at the actual issues of freedom of conscience on which this country was founded.
One of the things, I mean, it seems to me in the past, 20, 30 years, these courts become more just political appointments rather than, judicial and jurisprudence type of appointments, where people are good judges, they have training in prosecution or defense and have, gone through the ropes and learned by doing. And we have people that aren't necessarily qualified in that manner. Do you feel that the state of Washington, that their reasoning, I happened to read the amicus brief, and it seemed as if their reasoning was specious, in my estimation. Do you feel that that was the case also, that they were just using, I'll call it, political force or brute force to decide what, the way they wanted the decision to come out?
Well, the original intent of the court was to interpret laws that exist, not to make new laws. The branch of government that's supposed to make laws is Congress. And Congress, whether it's a state Congress or whether it's a federal Congress, Congress is to represent the will of the people. But the biggest problem we've had since Roe versus Wade is that the court has decided to make laws. And that's not their job. And so, yes, I think the court should not be involved in making new laws. I think the court should not be involved in eliminating what is our First Amendment right, which is our right of conscience. That's what the whole country was founded on. So that's the point of why we're the United States of America and not a colony of Great Britain, because we have a right of conscience. We have a right to do what we think is right, and that is taken away in the Storms case in a big way, in a way that has excuse me, in a way that has huge precedent for the freedom of conscience of all Americans.
I believe it's the free exercise clause of the First Amendment that they would be overturning, basically, if I remember correctly. Now, I wanted to.
When you overturn the First Amendment, you overturn the foundations that the country is founded on. It becomes a different country, and we need to fight for the country that we grew up in.
Mm-hmm. I wanted to ask you about another case that's in front of the Supreme Court right now, the Texas clinic regulation case, which is, I think, the state of Texas versus Hellerstedt. Is that correct? Oh,
yeah.
No, Whole Woman's Health versus Hellerstedt.
Whole Woman's Health.
Yep, and that's, I was down at the National Right to Life Convention in Dallas when a lot of that came down, and Rick Perry came and spoke to us and said, we're going to hold another special session, and we're going to pass, he passed 3 or 4 pro-life bills in that one special session, and one of them was this particular case that I guess abortion facilities need to come up to the standards of normal hospital facilities or ambulatory care facilities. Do you know where we stand on that? Is that...
Well, that case is also before the Supreme Court, and it's a very important case because in this particular case, we're talking about women's health and safety. We're not even talking about the life of the fetus. We're talking about women who get killed by inadequate, by poor, substandard medical care. And to even call an abortion medical care is a stretch because abortion is not medical care. Abortion does not promote health and human flourishing. Abortion is a surgical attempt to solve a social problem. So I stretch it to call it medical care, but the fact is women are undergoing an invasion of their body using medical instruments and under conditions which are substandard and don't meet the same conditions of health that other surgeries are held to. And so even if you were pro-abortion, it's only common sense that you would want women who are having surgeries to have those surgeries under safe circumstances. And that was the point of the state of Texas, was to cause abortion clinics to treat women the same way other surgical facilities treat women, that is with respect, safety, just common sense regulations, with facilities that will allow emergency care. I mean, some of the horrendous stuff that has come out of Pennsylvania, everyone should know about the Gosnell case. That's the kind of thing that Texas is trying to avoid and trying to protect the women of Texas. So it is very telling that the pro-abortion side wants abortion under any and all circumstances with very little consideration of the health of women.
Well, that's something. Now, what about the aspect of the state of Texas saying, well, we can regulate our own medical facilities. We don't need the federal government to come in with a heavy hand to decree that, that facilities don't have to have or can have substandard levels of medical facility care. Let's call it that.
that's a very interesting issue because up until this point in history, the states have always been responsible for regulating medicine within the state borders. But here, and especially with Obamacare and with the Affordable Care Act and with other acts, you have a attempt at federalization of what has always been the right of the state and the people of the state to determine, and that is the practice of medicine within their borders. So there is actually more at stake in this case than just an abortion clinic case. It's the case of can a state and can the people of a state still have a say in what happens in medical care in their state. That's always been the right of the state since the very beginning.
Mm-hmm. And I wanted to ask you two more things where time is getting short. You wrote an article in National Review Online entitled The Times, I presume it's the New York Times, Convolution of Facts on Abortifacients. What were you arguing there in that?
Well, the way in which many people look at drugs like Ella that we talked about is they look and say, is it a contraceptive? Okay. Well, to talk about contraceptives, again, it brings up the issue of the real question, which is, does it kill a human being? And there are drugs and devices which clearly can kill a human being after fertilization. And it's important that people understand that just because the FDA labels something a contraceptive doesn't mean that it works before fertilization. And I wanted to make sure that people understood that.
Mm-hmm. And then finally, the Little Sisters of the Poor, that case is also being heard, or I guess it's been heard and will be decided upon probably by the end of this court session, which is in June, late June typically. What do you make of that case, and what is the importance there?
Well, that again is a critical right of conscience case, which actually involves the right of every American to make a decision not to be involved in the taking of someone else's life. And again, as a country, we've always said that conscientious objection, especially when it comes to taking human life, the conscientious objection was something that we would respect as a nation because we are founded on conscientious objection. So with the case of the Little Sisters of the Poor, you have a group who does not want to be involved in taking human life. And very clearly, the drugs that they are being forced to pay for and the devices they are being forced to pay for by the Affordable Care Act take a human life. That's Ella and the IUD. They clearly take a human life after that embryo has been conceived, after that embryo has formed. So here again, the federal government is saying, you must do this. And if you don't do it, we will impose crippling fines, $100 per day per employee, that will basically bankrupt the Little Sisters of the Poor. And so, this particular issue is one of fundamental right of conscience for all Americans.
Mm-hmm. And Dr. Harrison, with just one question I was musing on as we were talking here. With 85 or 86% of OBGYNs not performing abortion, can't they rise up in great numbers and tell ACOG, American College of Obstetricians and Gynecologists, which has been pushing the abortion elements since before Roe versus Wade, couldn't you switch the numbers, or is there a way to have an election that you can change the board at ACOG?
Well, I would celebrate the day when my fellow OBGYNs would rise up and tell ACOG that ACOG's radical pro-abortion policy does not represent their membership. In fact, ACOG knows this very well, and that's why ACOG has never polled its membership about their position on abortion. The ACOG position on abortion has come about because a few people in ACOG leadership have decided to use ACOG as a vehicle for promoting abortion throughout the United States. And it is a detriment to the membership. It's a lack of respect for those of us who still care about both of their patients. And I would celebrate the day that those OB-GYNs who remain members of ACOG would rise up and change ACOG. I think it's time. It's time for the OB-GYN members to let ACOG leadership know that this radical pro-abortion policy that ACOG has adopted does not represent the membership of ACOG.
Mm-hmm. Well, does the membership vote for the leadership? Is that, or is it?
The membership does vote for the leadership.
It does? And
the membership does vote for the presidency of ACOG, but the problem is ACOG policies are written by the Reproductive Health Division of ACOG, which is not elected. ACOG elects its president, but it does not elect the Reproductive Health Division of ACOG. And many people within the Reproductive Health Division of ACOG are also deeply involved in abortion advocacy. And so you have that abortion advocacy group writing ACOG policy. And there isn't much that the elected leadership of ACOG can do about it. No, there needs to be a fundamental change in ACOG, in ACOG structure for it to finally represent the membership.
I see. Well, Dr. Harrison, thank you so much for sharing your thoughts and your insights both on the case of the pharmacist in the state of Washington and also the state of various abortifacients and the conscious rights of physicians and pharmacists and everything else. And thank you so much for all the work that you're doing. It's such important work. We really appreciate it, and we wish you well in the future.
Well, thank you so much for inviting me. I really appreciate it.
Okay, thank you, Dr. Harrison. We hope you found today's show to be unique, informative, content-rich, truthful, and thought-provoking. Thanks for watching. I'm Brendan O'Connell, your friend for life.